fluoride is not a nutrient. Its absence creates no observable deficiency state. There is no biological process that requires it as a cofactor, and there are a great many that are known to be poisoned by it. Toxicology specifically recognizes it to be toxic to bone, kidney, liver, thyroid, and brain, and an endless list of specified biochemical processes. Not only that, but data from the U.S. Public Health Service going back decades acknowledges that there are subsets of the population who are unusually susceptible to the toxic effects of fluoride, including the elderly, people with less than adequate nutrition, and those with cardiovascular and kidney conditions.
The need to update previously established fluoride guidelines is even more urgent now. Fluoride exposures have dramatically increased for all Americans since the 1940s when community water fluoridation was first introduced. In subsequent decades, fluoride was also introduced for use in dental products applied in the office and at home, such as toothpaste and mouth rinse, and during this time frame, it was also added to other consumer products. Understanding fluoride exposure levels from all sources is crucial because risk assessment for fluoride in water and food should now be inclusive of these common multiple exposures.
Risk assessment is a set of standardized procedures for determining a level of exposure at which there is an expectation of no negative health outcomes for the entire population. So, when we have a large group of verified findings showing how fluoride has a deleterious effect on children's IQ, or the data on development of dental fluorosis like we discussed earlier, we can start to apply standard risk assessment methods to determining safe limits for fluoride exposure.
Thus, risk assessments must consider the total fluoride exposure from all sources, educating medical and dental practitioners, students, consumers, and policymakers about sources of fluoride exposure and the associated potential health risks is essential to improving the dental and overall health of the public. In summary, given the elevated number of fluoride sources and the increased rates of fluoride intake in the American population, which have risen substantially since water fluoridation began in the 1940s, it has become a necessity to reduce and work toward eliminating avoidable sources of fluoride exposure, including water fluoridation, fluoride-containing dental materials, and other fluoridated products.